Hi, everybody. Happy February 10th. Only 4 days till Valentine's Day. And of course, that makes me think about love life and sex life and the need to keep everything fresh and joyous. And I guess one of my biggest professional mantras is that women are entitled to have comfortable and enjoyable sex. And I think, to be honest, the Me Too movement for me was a really seminal moment in um, the history of women's rights because it was women saying, no, I don't want to be forced to have non consensual sex by powerful men. And it was sort of a stepping stone to say, hey, what if we want more than just consensual sex? What if we actually want pleasure? Ooh, do we dare? Do we dare ask for that? And in a society that, for, to be honest, centuries, if not millennia, has had the purpose of sex be either conception, bearing children, or male pleasure, I think it's really time for us all to own the fact that women deserve to have pleasure too. So, on this February 10th, 4 days away from Valentine's Day, I'd like all of you to give yourself permission to reinvent and reinvigorate your sex life, whether that's with yourself because you're by yourself, or because you're starting to online date and you want to think about being sexually active again, or because you're going to be sexually active for the first time, or you have a long term sexual partner and things are kind of stale and they're getting kind of rote, and every Friday night at 10 o'clock, missionary position, 10 minutes later, you're done. Um, I think it's time, it's a great time of year to kind of look in the mirror and say, time for a little zhuzhing, time for a little change. So one of the best ways to refresh your sex life is by honoring your vagina, the tube of tissue that absolutely is important to most people's sex lives. The clitoris, of course, being also super important. And we're probably going to have another Gynecollege episode that will hone in on the clitoris itself and pleasure, um, and delve a little more deeply into the use of sex toys, not just on the clitoris, but everywhere. So stay tuned. That's going to be super fun. That might be one to just go ahead and get a glass of wine or two as you tune in. But tonight we're going to honor the vagina, and we're going to talk about how we honor it by keeping it healthy. You may not know this, but there are times in our life when the health of the vagina is quite impaired. After childbirth, for one, and not just because the poor vagina has been beat up because of the traveler going through it or an episiotomy, but because there is a rather dramatic plunge in estrogen after a baby is born. And when women breastfeed, they continue to have less estrogen, healthifying the vagina, if you will. So sex can become uncomfortable then. Also, the obvious time, menopause. When women go through menopause, um, the ovaries are supplying the vaginal tissues and the clitoris and the vulva and the bladder, all with less estrogen. We call this GSM, genitourinary syndrome of menopause, and it really wreaks havoc on the genitourinary tissues. And the bad news is it's chronic and it's progressive. So it's not like this happens for a few years and then the vagina is fine. Nope, vagina gets thin, the tissue gets thinner, the collagen breaks down, which makes for stiffness, inelasticity, and discomfort with sex and GYN exams. The blood vessels reduce in number. So beautiful, deep, juicy pink of a vagina becomes pale pink, becomes almost yellowish white. The nerve endings for pleasure decrease, the nerve endings for pain increase. All these really rotten things begin to happen. But fear not, this is all easily corrected. Um, there are ways to use, that's my cat, Ruby. She would like to be part of the show. There are ways to use medications, and there are non medication ways. Hey, Rubes. So let's talk about that. Ways to help improve the actual tissue of the vagina. Number one is vaginal estrogen. Vaginal estrogen has been around since 1946. Not telling you anything new. It's been well studied. We've studied it for risk of cancer, heart disease, stroke. Nada. It's super safe. The doses that are out on the market today that are all FDA approved are extremely low, and it's extremely safe. The most commonly used way to turn around an aging or otherwise dry vagina. Vaginal estrogen comes in rings, in capsules, in tablets, in suppositories, in creams. Lots of options, lots of companies. Some are better covered by insurance than others, but they all work. They all take around 8 to 12 weeks to start to work. So I tell people, give me 3 months and I'll help. So no matter what modality you use to help the vaginal tissue, count on 3 months. Okay. After vaginal estrogen comes vaginal DHEA. Okay, DHEA is a steroid hormone just like estrogen. And vaginal DHEA is made into a suppository that's inserted nightly. It's a little messy and a little hard to remember every night, but you don't have to worry about remembering every night. Just do it as many nights as you can. It will turn on production of estrogen and testosterone in the vagina and make nice, juicy, healthy cells. Okay. Again, 8 to 12 weeks till you really see results. You may start seeing them as early as 4 weeks. Number 3, ospemifene. Okay. Ospemifene, or the brand name is Osphena. Ospemifene, how do we spell ospemifene? Ospemifine, ospemifene. Hard to say. It's a daily tablet. You take it with food. Great job. And FINE, ospemifene. Anyway, it's a tablet you take daily with food, and it will work to turn on estrogen receptors in the vagina, the bladder, the vulva, all the genitourinary tissues, and also in the bone. So you're getting free osteoporosis help. Hey, Rubes. So if you take ospemifene, and if you have osteoporosis and you take ospemifene, you're getting an osteoporosis improver as well. It's very well tolerated. Its side effects are minimal. You may get some hot flashes. Rarely women can get leg cramps, but it is a very well tolerated medication. So let's review. You've got vaginal estrogen, vaginal DHEA, and ospemifene. All 3 will actually change the cells in the vagina and make you have a wonderful sex life via a more comfortable sexual experience. What if you said to me, I don't really want any medication. I can't use estrogen. I'm a estrogen positive breast cancer survivor, or I'm just scared. I don't care what you say. I just don't want to put anything in my body. Well, there is the use of laser in the vagina, which sounds absolutely frightening. It's absolutely not. It's safe and effective. In the United States, the first laser to be used in the vagina was made in Italy, and it was brought to this country and FDA approved in December of 2014. Because it's built by an Italian company that gave it a cute little Italian name, the MonaLisa Touch. They're proud of Mona Lisa. It's fine. Anyway, CO2 laser is something that's been around in the United States for decades. It's been used on the chest, on the skin, on the face, all kinds of places and all kinds of applications to regenerate cells and to heal tissue. Well, finally, in 2008, 2 doctors in Italy thought, why don't we figure this out for the vagina? And they created a laser and a probe that goes into the vagina. And I was just lucky enough to be able to bring it to America and be one of the very first doctors to use MonaLisa Touch. So I have a lot of experience with it over the past 8 years. And without question, it is safe, it is effective. In our office, I think it's probably over 90% effective, meaning over 90% of our patients show significant improvement in vaginal dryness, sexual pain. We also use it for recurrent urinary tract infections. We also use it for women with overactive bladder. We also use it for women with prolapse to keep the prolapse from getting worse. So we see improved bladder function. We see women with less vaginal pain, less dryness, more endogenous innate discharge. They have less pain with sex. They have less pain with their GYN exams and don't dread them so much. They have improved sensation. It's just changed gynecology in my practice for sure. And I have women who have used it now for 8 years with me. You come 3 times initially to make the tissue better, and then those sessions are about 6 weeks apart, and that improves the tissue. Sometimes we have to do a fourth treatment. And then if we're using this in the vagina, you come about once a year. All right, every 9 to 10 months is best. If you have a vulvar condition like lichen sclerosis, you may need to come more. You may need to come a couple of times a year. Um, Sadly, it is still not covered by insurance, so there is out-of-pocket cost. But people with flex spending accounts or health savings accounts can use those. That can use those to cover the cost. Um, so would someone with HPV positive pap be a good candidate for this laser? Someone with an abnormal pap smear is a perfectly normal and fine candidate for the laser. There actually is no one who isn't a candidate for the laser. There are no contraindications to it. There are no people for whom it's dangerous or risky. This cannot do anything to the HPV. This can't make a pap more abnormal or bring back an abnormal pap if you had an abnormal one in the past. And that's because HPV is a virus that is, once it's there forever. You can't get rid of it. And if it's turned your pap abnormal, your pap is cells from the cervix, and the laser doesn't actually touch any cells on the cervix. It only uh, fixes the cells in the vagina. So the cervix is at the very back of the vagina, but picture the cervix as the back wall of this room, like that door. And if I were painting all the side walls, I'd never really touch that door. So someone with any abnormal pap, including HPV positive pap, totally fine to have the laser. Absolutely not contraindicated. Great question, by the way. Thank you so much. Please ask me more. Interrupt anytime. I know Ruby does. So I guess I wanted to talk to you about those options to regenerate vaginal tissue. I know the word regenerate or rejuvenate, a lot of people say. I don't really like rejuvenate because it sounds so, oil of Olay, Kim Kardashian, like you're promising something fake. There's nothing fake about what the MonaLisa laser does or the estrogen does or anything like that. It really truly creates new cells and new tissue, which has just been phenomenal. But what about other things? What about things that don't necessarily make new cells? Let's say you don't want to take medicine or you can't afford the laser, but you just wish you could have some more moisture. You wish you had a little magic wand for more moisture in the vagina. Well, that is actually possible. Everyone knows about lubes, right? And there's silicone-based, water-based, oil-based, all kinds of lubes. And you can blend them, you can have them be flavored or tingly or all kinds of things. We could do a whole Gynecollege just on lubes, and I think we should. But tonight I'm going to talk about something called vaginal moisturizers. They're different from lubes, meaning you're not going to use them in the heat of the moment during sex, although you can. But vaginal moisturizers are a great option to use a couple of times a week to just keep the vagina moist. They have hyaluronic acid as an ingredient. Hyaluronic acid is used in high-end facial moisturizers, and it pulls moisture through the skin. So it really does make your skin feel moist. Well, same in the vagina. If you insert a vaginal moisturizer cream or suppository into the vagina, the hyaluronic acid in that suppository will pull moisture through the walls and actually give you more of your own moisture right into the vagina. So it's really cool. And you use them about twice a week. I have some patients that say, I don't care. I'm just going to use it every day. I love it. And they love it and they just love it. So there are a bunch of cool companies now that make hyaluronic acid containing vaginal moisturizers. And you can certainly look those up. I'm happy to share them with you. Also, you can always reach me at www.princetongyn.com. That's my website. And easy peasy to reach me through my website or call the practice 609 430 1900. Easy. Okay. So vaginal moisturizers, great idea. They're also a great adjunct with the vaginal estrogen or the MonaLisa. Often we'll use several things at once, okay? So I did want to just make sure you guys all know when women become menopausal, um, what exactly happens to the vagina and how do you become menopausal? So you can become menopausal naturally, and the ovaries just stop making the estrogen and progesterone and testosterone that they used to make. But you can also become menopausal surgically, right? You can have a hysterectomy with the ovaries removed. Just having a hysterectomy does not mean you're menopausal. If the uterus is removed, but the ovaries are not, you're not going to be in menopause. Okay. And I have so many patients that say, I need my uterus removed, but I don't want to be in menopause. You don't have to be. If you leave the ovaries there and they're still functioning, you won't be menopausal. But surgical menopause is when you remove the ovaries surgically. Chemical menopause, what the heck is that? Chemical menopause happens when you are put on chemotherapy or some other kind of therapy that actually shuts down the function of the ovaries. This happens to women who have breast cancer that is estrogen receptor positive. Estrogen receptor positive breast cancer is treated long term by putting patients on anti-estrogen medications. Those anti-estrogen medications are effectively chemical menopause, and the effects on the vagina and the bladder and the vulva and the clitoris are dramatic. Dramatic. So, if you're a breast cancer patient and you're on tamoxifen or you're on an aromatase inhibitor, and you're wondering, why is sex not possible for me? Why can't I have an orgasm anymore? Why does this all feel so horrible? Well, you probably know it's a side effect from your medication. But what I hope you know now is that you can find help and you can get improvement without medications. Okay. So, cancer survivors that cannot use estrogen replacement are candidates for MonaLisa. In fact, they're poster children for MonaLisa. Um, but the previous woman watching, I bet it was a woman who asked that question, really brought up a great question. Who isn't a candidate for MonaLisa? I mean, the answer is anybody. We used to say, boy, if you had a lot of prolapse, maybe don't have it. Not true. You can have prolapse and have it. In fact, we find when you have prolapse and you get MonaLisa or use vaginal estrogen, it just keeps everything healthier. If you have herpes, can you have MonaLisa? Yes, you can have MonaLisa. But if you have genital herpes, I usually ask you to take some medication that day and the day after, just in case the MonaLisa laser could kind of stimulate an outbreak. I've only had it happen twice. And it was both times a patient who actually forgot she had genital herpes because it had been 20 years. And we did the laser and it made a little outbreak. So if you have genital herpes, you can still get the MonaLisa laser, but use some medication. There's no preparation. You don't have to fast. You don't have to abstain from anything. You just come in the office. We put a little numbing medicine on the outside, sort of right here, like the vestibule, we call it, kind of right where the penis or tampons first go. And we leave that on for 5 minutes. We wipe it off. We dry the vagina with some Q-tips, and then we insert the probe and we fire the little laser dots all around, and that's it. I'm going to show you a video in a few minutes because most women have no issue. They have no discomfort. They're worried. They're worried before it starts that it might hurt, and they're all underwhelmed. They say to me, wow, that was absolutely nothing. So I'm going to show you a video in a couple of minutes of a patient who just had her first MonaLisa, and she was kind enough to let us videotape her as soon as she finished. And I got to ask her some questions, and she answered them. And I think they'll be helpful to any of you who are considering it. Um, I'm trying to think what else I think is super important to say tonight as we near Valentine's Day. And I think, when I think about kind of reinvigorating or reawakening or just recharging a little bit of sex life, um, don't think of it just as, well, I have to find a new position or we have to do something crazy or I have to do something I'm uncomfortable with. I don't think that's recharging your sex life. I think a lot of it is communication, Is intimacy, is non-penetrative sex focused kind of enjoyment, thinking about pleasure from small things like undressing your partner or foreplay or oral sex or just cuddling. Um, for so many couples, sex seems to be about orgasm. And I think that puts a lot of pressure on couples, young and old. I have a lot of college age and graduate student patients who are so stressed about the fact that they feel they have to have an orgasm. And that's the way to show their partner that they're good in bed. I don't think that's how you show anybody you're good in bed. And I don't think you have to prove to anybody you're good in bed. Um, but I think if you have a partner that you feel like you can communicate with, I would just start by having kind of Friday afternoon 30-minute like cuddling intimacy dates where you just turn the phones off, take them out of the rooms and pick a couple topics that are off limits, topics that are sort of annoying like politics or bills or marketing or children. Nope. Talk about something fun or funny, or something that's just between the two of you and laugh together and be physically close together and eventually touch each other. But you can touch each other in a G-rated way and still build intimacy. And I think it's really important if you think of sex almost like a pyramid and you think of orgasm at the top of the pyramid, not to feel like my goal is to get to the top of the mountain, but to feel like you get to climb the whole mountain and you get to enjoy all the different parts and all the different levels, the talking, the cuddling, the undressing, the touching, all the different things. Sure, it's also cool to get new lingerie or to lose 10 pounds and say, wow, I feel really great about myself, or to have some Botox, or to just enjoy how you look and say, I feel beautiful about how I am just as I am. And all those things are part of feeling good about ourselves and feeling good about ourselves as sexual beings. But, I think sex. A lot of what we feel as women are important points of sex are sort of messages we've been given by men. And I would urge you to think past that and to think about what, as a woman, gives you pleasure. And hopefully, you can find the way to communicate that to your partner, whether your partner's male or female, so that sex can be pleasure for everyone, not just for your partner. So that's kind of the message I think that's really important to give. If anyone has questions, please ask. Um, does Mona Lisa help with dry tissue surrounding the vulva too? Absolutely. We have different, Gail, we have different probes, one for in the vagina and one for outside on the vulva. So we use it to, we use Mona Lisa for in the vagina, right? And we use that for bladder conditions and vaginal dryness. But this other probe we use on the vulva for skin conditions, diseases, and just for areas of the vulva that are thin. Same around the bottom. We can do that too. So many women come to me and say, thanks, vagina's nice and moist, great. But look what happened. I had sex and there was this little split or cut. We'll use some topical estrogen or the Mona Lisa or both. Thank you, Gail. Great, great question. So if anyone else has questions, please speak up. I'm here for you. Okay. I mean, I'm kind of here for Ruby the cat too, but I'm really here for you guys to answer your questions and to help, give you an opportunity to kind of learn about, yes, about Mona Lisa, but you can ask me about anything. You can ask me about anything. And if you have a lot of questions or you just love to chat for 15 minutes, I love doing telemedicine visits. I think they're fun and it's like a way to just have a really kind of private, intimate chat and help you any way I can. So listen, we're going to put on this video. It's about 6 minutes, so you don't really need popcorn or anything, and you don't need to get up to pee first. It's really short, and you'll get to meet my patient Inga and see how she fared after her first Mona Lisa treatment. Okay, so I hope you enjoy the video. Before we start it, I just want to remind you that there'll be another Gynecollege in a couple of weeks. And stay tuned. We're going to post a whole bunch of new topics. And if any of you have suggestions for topics, please send them to me, info@princetongyn.com. or call and let me know. I'd love to talk to you. Okay, love you guys. Happy Valentine's Day, and I hope you enjoyed the video. And if you have questions after the video, I'll be here. Hi, Inga. Thank you for coming in today.
Absolutely.
So I'm here today with Dr. Inga Reagan, who's a local physician in the area and who's also just had her first MonaLisa procedure. And I wanted her to speak with you all today with me so that you could hear a patient's impressions of how MonaLisa went when she really had never had it before. And even though she has some of the know-how of a physician, it was still, as a patient, her first time. So Inga, thank you for being willing to do this with us.
Absolutely.
Tell me what you felt and how it felt like when you were having the procedure.
Yeah, so the procedure itself was super easy. I have to say it was actually maybe even easier than my annual GYN checkup. So there's an anesthetic that's used. We chit-chatted like we always do, and it was over before I knew it. So super easy. And I think the next two will also go just as easy.
Did you feel any pain?
Not at all. Not at all.
What did you feel?
Just that, movement, just like when you have the speculum in for your exam. It was kind of that exact same feeling. Right. But other than that,
okay. Many patients tell me they feel like a vibration sense. Did you feel that at all? Not
I
much.
did.
You had a lot of numbing
I had a lot of anesthetic in there.
We put a little bit of numbing cream. I'll take my little puppet here. We put a tiny bit of numbing cream right at the opening. No numbing inside because you don't really need that. And that's usually all people really need to feel very little. Questions you have for me about going forward today, tomorrow?
Sure, and I think there are questions that most patients may have. So one of the questions would be, when do you get a little discomfort afterwards, like when the anesthetic comes off? What is the rest of my day going to look like?
Right. Yeah. So you'll be able to do whatever you do, whether it's firefighting or treating people in an emergency room or teaching school or working Zoom calls from home. There's no need to be on bed rest. There's no need for any special diet or any restricted activity. I do tell people to abstain from sex for a day or two. It's probably overkill, but it's more so that they don't have the anxiety of wondering if it will be uncomfortable. The numbing that we put on lasts several hours, and when it wears off, some people tell me they feel the equivalent of like a sunburn, almost an itchy, stingy, burny feeling right at that opening. If you feel that, you could take ibuprofen, or you could apply a little aloe vera or a just topical over-the-counter steroid like hydrocortisone, or you could just put a little ice pack there. I have never had anybody need Percocet or need to come back, or anybody have a burn, or anybody have anything. The skin is not burned. The skin is irritated from the little dots on the MonaLisa. But other than an Advil or an ice pack or a little aloe, I think no one, just treat it the same way you would treat a minor skin irritation.
And how long might that last, that discomfort?
Well, it depends on the patient and how much work we've done. If you have a vulvar condition, a skin condition on the outside where we've done a lot more laser, you might have that for 2 or 3 days. For most women who have just the vaginal treatment and a little bit just at the outside opening, it's usually a 1 day and that's it kind of thing. Okay. I don't prescribe anything different because you don't really need anything different to manage that discomfort. I want you to come back and have your next treatment somewhere in the 4 to 6 week range. It's not important that it's a precise amount of time. This is not chemo. And the procedure is very forgiving. So if you're on vacation, it has to be 5 or 6 or 7 weeks, that's okay. But I'll want you back for a second and then a third. Some women even need a 4th or a 5th treatment, again, depending on what we're treating. But I would say over 80% of women do just great with 3 treatments followed by an annual maintenance treatment.
Yeah, I'm also excited that I think you get less UTIs, you get less yeast infection, all those extra problems from atrophy.
Right, the genital health overall gets better, and that translates to urinary health. And as women age, urinary urgency, frequency, UTIs become a real thing that you see in the ER.
Exactly.
So I like to tell women, you think you're doing this for right now, 2022, so you can have comfortable sex, but you're also doing it for 20 years from now, so you're that patient that's not in the emergency room with the urinary issues. I literally think it should be every year covered by insurance for all women. I think we'd save a lot of money on UTI treatment and things like that. And the really interesting thing is recently there have been studies looking at prolapse, at uterine prolapse and vaginal prolapse. And we're finding that women who do this twice a year have a pause in their prolapse. It doesn't worsen as it does in many women. So I think we're just scratching the surface of the benefits of this. And I know one thing you told me you like is that it's actually making new blood vessels and new collagen,
Yes,
right?
correct.
You had a procedure in your arm that was doing the same thing.
Correct.
Tell me a little about that.
Right. So basically, different kinds of tendonitis, they often will give steroid treatments, injections, and then studies were done that found that just the anesthetic part could, because of the extra stimulation of blood flow, brings health to the tissue.
Right.
And I went ahead and tried that out.
Yeah.
And it worked for me beautifully. So it made sense to me, because initially, like many women, I thought, ooh, lasers in the vaginal area, I don't know about that.
Right.
But the idea of little micro injury to the area to help stimulate blood flow actually made a lot of sense, and was proven to me. So
yeah, so it makes sense.
So I'm here today.
Yeah, intellectually. I'm
Yeah.
going to show you guys. I don't know, Melissa, if you can see, but the little dots are right on there. And those are the same little dots that the machine makes when we do the procedure. And I'll show you in another part of the video, because we'll actually get the little dots and the probe. But exactly. So sometimes little tiny injuries, we call them, result in new blood vessels and new collagen, and then we all benefit from them. So any other questions for me?
No, not at all. Thank you so much for making it super easy. I was a little nervous, and it went fine.
Good. That's so good to know. Yeah. Thanks so much, guys, and we'll catch up with you in another part of the video. Great. I think that was pretty clear, and I couldn't have said it better myself. So I hope you guys learned something tonight. I hope you all have a wonderful Valentine's Day, and you honor yourselves and you honor your right to a happy and pleasurable sex life and a healthy vagina. And if you have any other questions, please don't hesitate to find me at princetongyn.com. And I'll look forward to the next Gynecollege. Ruby, the cat, and I look forward to talking to you at the next Gynecollege. If there are any other questions, speak now, or we'll catch you next time. Thanks so much. Good night.